Health and knowledge. How does the application of knowledge affect our decisions for good health? By Marlon Young. The problem. Industries have gained a powerful foothold in America because of the efforts of a relative handful of very wealthy, extraordinarily powerful, self-interested inside players, their paid-off hench people, and agencies such as the FDA, as well as the unwitting participation of millions of bit players and trusting consumers. So we can't really say this is a conspiracy, except in so much as it is a conspiracy to protect shareholder profits. Nevertheless, the end results, our epidemic of obesity and disease, are just as horrendous as if these contributing players had reconnoitered in a back room and agreed, let's get rich at the expense of Americans' health. Corporations are able to market injurious substances like MSG and aspartame to Americans because of FDA approval. Many people are dying or taking a hit on their health due to poor choices made that affects health. We have become less concerned with nutrition and more concerned with medicine, money, or putting things in our body that do more damage than good because many do not know the danger of what they put in their system. Many people have put their trust in the government and medical industry to provide good health, but as a result of that, many have been deceived and are dying. More and more people are dying at a young age from health-related issues. There has been an injustice in our health care, which is totally unethical. A greater influence on a person's health is their possession of higher education, higher knowledge. We must do better to bring awareness to this and start by educating our future, which is our youth, to do better, to get ahead of this. Applying accurate knowledge about our health is very diverse and it affects all of us across all levels, all nations, all races and religions. Lives are cut short due to harmful things people have been putting in their system as they depend on agencies like the FDA to protect them from harm when it comes to food. Our nutritional education actually comes from the factory food manufacturers. Hospitals are now another branch of fast food franchises. Many times you go in hospitals and you'll see the fast food franchises like the KFCs and the McDonald's right in the hospitals. Food studies work with the factory food companies to sell us more of their products, which trumps access to studies and knowledge of real food. One problem here is that we have become consumers with a quick fix mentality. We must have everything and have it now the easy way. More effort from the government is put into medicine to treat many preventive diseases, but less effort is put into educating people on how to eat to not get disease or sickness in the first. I remember way back in the days when grandma had a natural remedy for any sickness you had. Now, we are quick to get a pill to fix everything. Long ago, many of us knew how to hunt or grow real food, and it was important to eat real food. Boy oh boy, have times shortchanged. Another part of the problem is that there's so much to profit from this quick fix mentality. You see, as more people become obese or unhealthy, it creates profits to now treat them. Many of our scientists have to rely on industry funding for their research and have the pressure of having their funding cut off if research does not support their benefactors. Corporations are able to market injurious substances like MSG and aspartame to Americans because of FDA approval. $60 billion a year drug dealing industry from providing medicine after you have become sick to make you even worse. They have every drug to help us to medicate ourselves and children when there is often a safe or natural alternative. Do we want to learn what to do when we get sick, or learn how to not get sick in the first place? Many of our medical doctors are not educated in nutrition. They go to school for years and years and years and have all types of degrees and meet all types of standards. But this should be a major requirement to be educated in nutrition and certified in nutrition. If we don't learn from our past, we can be doomed to not being better for our present and future. Reform is not just about removing junk from our schools. We got to do more than that. There's no real proof that better food at schools have a healthier effect. We have to educate our youth. It is not enough to have everything if we don't have the knowledge to apply it. Because of modern medicine, people are living longer. Yeah, but with tubes hanging out of them and beepers going off. Is this how we want to live? Is this what we want our youth to look forward to? One lesson I have learned in life is that you can pay now or pay later, but eventually you will pay when it comes to your health. Obesity in the United States is now a threat to public health. Each year, 300,000 adults will die in the United States from obesity-related health issues. As of 2004, the total of obese people in the United States reached 32% of the population. Among our youth, from 1999 to 2004, obesity has increased 17.1% in the United States. Some solutions. Children in households with more educated parents tend to be healthier in general. We can no longer be passive and depend on education, products, or information that is conveniently given to us. We must seek out our own education and apply it. We must not trust government to police agencies like the FDA. We must get back to real foods like our ancestors were raised on. Awareness of what is unethical about our healthcare and helping people to think critically about health is going to help with the application of knowledge we acquire. We must be able to go against foods, habits, or lifestyles our parents have handed down to us that are not healthy. We are limited by what we know and apply. You see, knowledge is not power by itself. We must be able to apply that knowledge for it to be powerful. Even in the Bible, Adam and Eve had the knowledge of what to eat and not to eat, but they did not apply it. In conclusion, whatever problem we have in life, there is always a solution. The problem here is that your life is in danger if you don't know the solution or have been given a solution that will harm you. This is what has been done within our healthcare system, and it is up to us to not continue to be passive about what is good for our health. We must actively seek out knowledge for better health with real ways to apply it for a better life for us all.